Botox, recovery, and how often should you do it, and how long does it take to work? So as you know, Botox is commonly injected in the glabellar area, the area between the eyes, crow's feet, forehead, and sometimes other areas like the chin and so on, bunny lines. Botox takes 4 to 10 days to work on average. So again, if you had your injection today, you'll probably look exactly the same tomorrow. Some people will work quicker, but the general rule of thumb is 4 to 10 days. How long does Botox last? Again, on average, it will last about 4 months. Every once in a while, I see somebody that says it lasted 6 months, or sometimes it'll be 3 months. All I can do is put it there, and that's the same as anybody else has. We can just put the Botox there, and it lasts how it lasts. How often should you repeat it? I personally strongly recommend my patients come in every 3.5 months. And the rationale for that is I'd like to re-inject their Botox before it has completely worn off. And the rationale for that is, particularly in the glabellar area, this area here, those muscles are strong, but if I keep hitting them with the Botox before the muscle recovers and can contract, that muscle will atrophy and get smaller and smaller and smaller. So a lot of times, not 100%, but a lot of times if they do it religiously for a year, they'll often, instead of requiring the usual 20 units here, sometimes only need 15 units. In some cases I've had patients just need 10 units. So that's the rationale. And also if there's any deep indents from the constant furrowing of scowling or staring in the sun, that deep line will gradually get less and less deep if they do the Botox on a regular basis. So I personally like to give my patients an appointment 3.5 months after they've had that treatment and encourage them to come in for regular treatments then.